Hi, Mr. Stanley. So before I start the video, I will be filming this myself because my parents are out of town and I'm an only child. So I'll be doing the demonstration on my dog. Just wanted to clarify. Alright, I'll just get into the video. Alright, so I am at the Pyxis and I'm going to go over the doctor's orders, the medication administration record, and I'm going to gather the necessary supplies, which is the medication and whatever else I need. And so I have my patient here, A. Carriaso, the date of birth. So I have the allergies listed are sulfa and statins, and I already reviewed this, and the patient should be okay to take all of these medications. And so the first medication we have listed is metoprolol, 50 milligrams by mouth once a day. That's right here. And then we have warfarin, 5 milligrams by mouth once a day. And that is right here. Then we have a multivitamin, 100 milligrams by mouth a day. That is right here. All right, and they are already in the correct dosage. And then we have cephalexin, 50 milligrams by mouth once a day, and the contraindication for this one is with warfarin, and it can increase bleeding risks within the patient, so I'm just going to withhold this medication and check with the doctor because I don't want to further complicate anything with my patient to avoid any risks. And so I'm going to check the expiration dates just to make sure they are correct. And they all are, and then I'm gonna start preparing my medication. So I'm gonna wash my hands, and then I'm gonna put on gloves because I don't want to risk touching the medication and just be on the safe side. Okay, so I want to check again, just make sure metoprolol, warfarin, and a multivitamin. So I'm gonna touch it. Okay, that's the metoprolol, the warfarin, and the multivitamin. All right, check it once again before I put it all away. I want to check it once again to make sure. Also, we want to put this back in the Pyxis. We don't want any medications left unattended. Alright, so I have the medication in the water cup. Let's go to my patient. Knock, knock. Hello, I am Juna, and I'll be your nurse today. I'll be administering your medications for the day, okay? Can you tell me your name? A. Carriaso, okay. Can you verify your date of birth for me? Alright, 2/16/2010. Okay, good. Alright, so I'm going to sit you up, okay? So that way you don't struggle taking your medications. This is to avoid aspiration. If this was a real patient, they'd sit up. Okay, so I'm going to check your medication. So you're going to take metoprolol, 50 milligrams, warfarin, 5 milligrams, and a multivitamin, 100 milligrams, are all going to be taken orally in a pill form. So is there any order you would like to take these in? It doesn't matter? Okay, let me scan your tag. And everything matches with the order. All right, so first we're going to be taking metoprolol, and this is a beta blocker because I've heard you recently had a heart attack, and this helps with your chest pains, and certain side effects can include low heart rate, trouble breathing, dizziness. So we're going to take that. Here you go. Alrighty, next we're going to take warfarin, which is a anticoagulant. So this can prevent blood clotting, okay? And so other side effects can include muscle pain, weakness, fatigue, purple toes. So here's that. Okay, good. And your last one is a multivitamin. Okay, so this just ensures that you get all the necessary vitamins and nutrients that aren't included in your diet, and certain side effects could be GI upset, such as nausea, or vomiting. So if this happens, maybe we can take it with food in the future. So here's this one. All right. Do you have any questions for me? You don't? Okay. So I will be leaving my call out here with you. If you have, if you experience any of the side effects that I mentioned before I check up on you, which is within like 15 or 30 minutes, just press the call light and I'll come back and assess anything that you need. But other than that, I hope you have a good morning. I'll come back and check on you. Here's my call light. If you need anything, just let me know, okay? It was nice seeing you. All right. Now I'm gonna dispose of anything and document any pertinent information and go speak with the doctor. Bye, Professor Stanley.